Go.
Okay. So our case today is Mr. Barnes, 57-year-old male. He's a patient on 3 liters nasal cannula. Vital signs are stable. He has bronchiectasis exacerbation and having trouble coughing up secretions. MD ordered Flutter, TID, or 3 times daily. So what we're going to go ahead and do is check our chart, make sure there's no contraindications, as in like active hemoptysis or untreated TB, which there's not. There's also no allergies that we need to be aware of. So we can go ahead, gather our Flutter, wash our hands, and put some gloves on. We don't have any gloves. We're just gonna pretend. Okay. Alright, so once we've cleaned our hands up and put our gloves on, we're gonna go ahead, enter the patient's room. We're gonna introduce ourselves, get 2 patient identifiers, and then explain what we're doing and why we're doing it. Hey, Mr. Barnes, I'm Dee from Respiratory. Looks like your doctor ordered a Flutter, so we're going to go ahead and go through the motions of how to do that and why we're doing it. Can I get your first and last name and your date of birth? That's my 2 patient identifiers. I'm going to go ahead and get some pre-vital signs. Get some breath sounds. At the same time, I'm putting my pulse ox on his finger. I'm making sure that I'm checking for any discoloration, any abnormalities, see if he has a high work of breathing, anything of that sort. And then we're going to go ahead and go through our demonstration. All right, Mr. Barnes, so for this, I want you to go ahead and take a deep breath in. Once you do that, I want you to make a tight seal around the mouthpiece, and then go ahead and exhale until you feel a fluttering sensation in your chest. That's how you know it's working. And I want you to do that about 10 to 20 times an hour. So every time you have a commercial break on your TV, that's when you're going to do this. And it looks like it's ordered for 3 times a day. So if you want to time it like after, before meals, that would be even better. And then I want to go ahead and make sure that the patient understands the directions. So I would have them demonstrate it at least 1 or 2 times. And then once I know that they know what they're doing, I can go ahead and leave this with them. Make sure that I'm doing the post-vital signs after the treatment. So again, breath sounds, pulse ox, checking for any kind of color, any abnormalities, any thing that would signify like a work of breathing issue, which I don't. So then after that, I would go ahead, make sure that he has his call bell, knows who the nurse is for him, make sure that I gather up all of my trash and all of my equipment, and then go ahead and leave.